What's up, Doc Mike? Today's topic for March 11, 2021. An update on masks, social distancing, and other public health guidelines. Thank you, Johns Hopkins Bloomberg School of Public Health.
Hi, I'm Lindsay Smith-Rogers, producer of Public Health on Call, the podcast. Today we're going to be talking about public health guidance and variants. So while scientists are still trying to understand all the details of the SARS-CoV-2 variants, there's evidence that at least one, what's called the B.1.1.7 strain, could be up to 1.5 times more transmissible. Today, epidemiologist Dr. Caitlin Rivers from the Johns Hopkins Center for Health Security will talk us through what this means for public health guidance. So let's start with what's different about this variant.
Well, emerging evidence is that the B.1.1.7 variant is more transmissible than the wild type, meaning it spreads more easily between people. And several countries where this variant became dominant and started to spread widely saw a severe resurgence. They had a new wave that they struggled to control. And so the fear is that if it were to become established here, that we could also see a resurgence.
And when you say wild type, you mean the strain of COVID that has so far been circulating around the world?
That's right. Viruses are always mutating, and so there are probably many variants in the United States, but most of them don't have any biological differences. It's not of public health significance. So the kinds of variants that we've seen to date are, we think, less transmissible than this new one that we have our eye on.
And so does public health guidance like remaining 6 feet apart, wearing masks, and avoiding indoor public places as much as possible still apply for this variant?
It does. Those are the tools that we have had all year to manage the virus, and those are the tools that we still have, and they do still work. What it means to face a more transmissible variant, though, is that we need to be extra dedicated to those tools. We need to be sure that we grab a mask when we go out. We need to avoid public spaces more often and really just redouble our efforts, because those are the tools that we have on hand. They do work, but if we're facing something that spreads a little bit more easily, we have to be that much more dedicated.
And so talking about redoubling our efforts, are 2 masks better than 1 mask?
What matters with masks is the quality and the tightness of the weave and the fit. So I do wear 2 masks when I go out. I wear a surgical mask that I got from the grocery store, and I wear a fabric mask on top. And what I like about that is it's multiple layers and it fits really tightly around my face. I can still breathe, it's still comfortable, but it's quite snug. And both of those things, the multiple layers and the tight fit, have been shown to increase or improve how well the masks work. And so I would recommend wearing 2 masks when you go out if you find it comfortable enough.
And so in terms of going out, should we be concerned about things like going to the grocery store? And I know a lot of kids are going to be returning to in-person learning. Are there anything else we should think about for that?
Right now, the B.1.1.7 variant is circulating in the United States, but it's a very small fraction of cases. What we're watching to see is whether that grows over time and whether it really precipitates a new resurgence. Right now, I think it's good to be cautious and thoughtful about time you spend in the community, but we're not in the midst of it. And so I'm not making any big changes to my life right now. But if that changes, and if I do start to see things worsen in my community, I would take those extra steps, like maybe ordering groceries instead of going and avoiding other places indoors in public, just to be sure that I avoid getting sick.
And so do you think we may have to implement stricter measures like lowering the number of people in indoor spaces if these more transmissible variants continue to spread?
I can say that places that have faced the B.1.1.7 variant and have seen it become dominant have had to return to stay-at-home orders because their healthcare systems were becoming overwhelmed. We're not in that place in the US. I am looking around the corner to see if that is the case. I don't think we know for sure yet, but if we do see a resurgence, we may have to re-implement some of the restrictive measures to help slow transmission. But we're not there yet, so it's really about watching and waiting and seeing how things unfold.
And what's most important for people to keep in mind right now?
Again, all of the same tools that we've had all year to slow transmission are still the ones that we have on hand. And so even though it's been a year and we're tired and we're bored of all of this, I think it's important now as ever to be really thoughtful and really careful when you go out of the house. Reach for those masks, reevaluate whether you really need to go to that gathering or that public space. And with vaccines now being administered and distributed, better times truly are on the horizon, I promise. But for now, we're still in the thick of it.
Thank you so much, Dr. Rivers, for joining us today. We so appreciate your time.
Thank you for having me.